Good evening, everyone, and welcome to day 8 of the Kerala Cancer Crusade and Cancer Literacy Mission being held by IRIA in the guise of the IRIA Preventive Radiology National Program. The topic for today that we'll be discussing, like everyone knows, artificial intelligence is one of the most coveted topics in radiology right now. And we have an expert speaker, Dr. Wong here, who is the Associate Professor of the Faculty of Computing and Informatics at Multimedia University in Malaysia. Before we start the scientific session, I would like to introduce, although he does not require any introduction here, Dr. Keshav Das, who is our chief guest, the Editor-in-Chief of the IJRI, Indian Journal of Radiology Imaging, and Deputy Director of Sri Chitra Tirunal Institute of Medical Science and Technology. Welcome, sir, and I would invite you to please give the inaugural address.
Thank you, Dr. Anil, and thank you, Dr. Rijo, for inviting me for this session on which is part of the IRIA Preventive Radiology National Program. It's a program in association with IRA Kerala and the Swasthi Foundation and Community Oncology of the Regional Cancer Center as part of the Kerala Cancer Crusade and Cancer Literacy Mission. So I understand that Dr. Rijo with his team has taken up a very noble cause on preventive radiology. Now, when I talk about preventive radiology, I remember the days in 1995 when I joined Regional Cancer Center, which is an institution which is very close to the institution where I work now, the Sri Chitra Tirunal Institute. And in those days, the mammography as a technique had just come in. And there was a lot of interest in this particular technique of CAD. It was called the computer aided detection. And this was perhaps that in those days, this word artificial intelligence was not very commonly used. It was CAD. And there were a few technologists during those days who were interested to understand more about picking up carcinoma breast early. Especially because screening was just getting popular those days. It was not yet started. But could there be techniques which could pick up these lesions if you are going to do a screening? That was what they were looking at. And there are a lot of engineering colleges, the faculty there approached us. Some of the industries were interested. And we also had shown an interest. But over the years, we have found that after this technology of artificial intelligence has come up, and a lot of new methods have come, which has improved day by day the methods of picking up these lesions. And the main goal, of course, is not to miss a lesion. The true positive should be 100%. So we should go for a goal by which we don't miss any lesions by techniques of artificial intelligence. And I'm sure our technologists, our engineers and scientists are working on that for the last several years. And this is a very apt topic which has been taken up because screening is becoming more and more prevalent. And with large numbers of images which are coming in, it might sometimes be quite difficult for a radiologist alone to look at all the images. So if a screening technique, a method by which an artificial intelligence method can be found out, you might be able to pick up some of these lesions. Then the radiologist can then later on look at these images and say that the lesion is actually there or not. So I'm sure that this will be discussed in more detail today by Dr. Wong. It is important also to realize that the artificial intelligence is becoming an important tool for the radiologists and of course for every medical specialist. Now the question is, in the curriculum of radiology presently, we don't have this artificial intelligence being taught. There are, I understand that there are a lot of radiology residents today who are very much computer savvy, interested in learning more about coding. They might have already learned it. And here is Anil himself, who has a lot of experience in this area. I think Dr. Anil should encourage and tell us how we can start this as a course, at least something like a 2 to 3 month course for MD radiologists, as well as those who are doing senior residency in radiology, so that they learn at least some amount of artificial intelligence, so that they can communicate with the technologists or the scientists when they are working in these areas. Many times what happens is the radiologists who don't get a basic understanding of these might find it a bit difficult to understand the language of a scientist. So it is essential that it is part of the curriculum, and we have to introduce that. And I was actually looking for such a possibility to introduce in our DM program. We have a DM program in our institute for cardiac radiology and neuroradiology, whether to introduce a short module of artificial intelligence also, so that once you learn this, you might not be able to understand it completely to the extent what a computer scientist learns, but we can communicate with them in a much better way. And this would be very, very useful. And we should look at such possibilities also. So again, a big thanks to Rijo and his team for taking up this particular area of preventive radiology. We can expect more talks like this in which we can learn how a radiologist can be useful in prevention of a disease. With these words, I thank Rijo, I thank Anil, I thank Dr. Wong, and I wish this program a success. Thank you very much.
Thank you, sir. Right. So, like you said, sir, you hit the nail on the head. Right now, the NMC has actually recommended that MBBS training have 2 months of internships in the translational sciences. And in fact, I've got an inquiry from one of the medical colleges here in Trivandrum, whether they could send final year students for 2 months to my organization for some sort of training on what AI is and all that. But I think we are heading in the right direction. It's required. So before we just go into the scientific session, a couple of things which sir also said I would like to mention here is, like sir said, the evolution from computer-aided detection has now moved to computer-aided diagnosis. And that is where actually artificial intelligence is trying to help in that, introducing that intuitive thinking that we get when we look at an image. And the second important thing which sir mentioned, and which I think is the right thing, is the focus has primarily been on screening modalities like chest X-ray and mammogram first, because these are the ones that require volumes and have to be taken to the actual areas where access to tertiary care or advanced radiology is not available, and AI is hoped to do that. And while we have been thinking that AI will not come, the FDA at last count has 523 FDA approved solutions in medicine, out of which almost 390 are in radiology. So even when we say that it's not happening, a lot is happening in the field. And right now, coming to breast, we have at least 4 or 5 FDA approved algorithms: Chiron Medical, Lunate, RadNet, Zebra Medical Vision. I think Dr. Wong will be speaking more about that. So we'll go to the scientific session. Before that, I'd like to introduce our speaker today, Dr. Wong. She has done her PhD in computing from the National University of Singapore and is currently working as Associate Professor with the Faculty of Computing and Informatics at Multimedia University, Malaysia. She's also the Deputy Director of Center for Lifelong Learning and Innovative Education, also called LEARN, and the Chair of the Center for Visual Computing. She has served as the Deputy Dean for Research and Innovation for Faculty of Computing and Informatics from 2018 to 21. She's extensively published in one of the seminal journals of engineering called IEEE, and has won several awards in exhibitions that are related to the field of computing and technology. She also serves as the co-chair for several international workshops and is on the organizing committee for many of the main annually recurring conferences conducted by IEEE. And for her dedication to teaching, she's also been awarded the Excellent Teaching Award by the Multimedia University in 2014. Thank you, Dr. Wong, for being here with us. And I would like you to please start the scientific session. Thank you.
Thank you very much, Dr. Anil, for the kind introduction, and also special thanks to Dr. Rija for the kind invitation, and of course, Dr. Kesavadas for the very insightful opening address. Okay, let me share my screen first. Okay. Okay, just to double check, can everyone see my screen and hear my voice clearly?
Yes.
Okay, great. Okay, very good evening to all. So I'm very delighted to share on the topic on AI in prediction of breast cancer using mammogram today. So before we start, let's all right, I think just now Dr. Anil mentioned about some FDA cleared, all right, mammography or software, all right, for AI software, all right, that have been cleared by the FDA. So let's take a look at what it can actually do. So I will actually share a video on Cure Metrics. This is actually the first FDA clear optimization workflow, all right, that can be used for the triage and also to sort the cases, all right, that can help to increase the workload, all right, reducing the workload of the radiologists and so on. So let's see what it can actually do. Or maybe you can share from your side. It's not clickable, the sound right now from my side.
Soumya, maybe you can try from your side if you have the presentation.
Yeah, the sound is not clickable from my side now. I'm not sure why.
Sure, just give me a moment.
Yeah, sorry about that. Just now was okay when we test, but now the sound is not clickable.
Accurmetrics are
Is it good now?
advanced algorithms and
Yeah, we
medical
can hear
imaging
you.
tools are useful for the radiologist in evaluating mammograms with greater speed and accuracy. When Curemetrics AI scans a woman's mammogram, it's actually doing that with the intelligence gathered from millions of mammogram images from women around the world. It adds an extra layer of precision, helping to flag suspicious cases and reduce reading time for more streamlined workflow, helping radiologists focus on abnormalities that could be missed with outdated technology. And then it scores them, providing the doctor additional intelligence, potentially eliminating unnecessary biopsies, which can increase costs and patient anxiety. It can also assess breast tissue density and automatically provide a density classification. And AI can even help detect a woman's risk of heart disease from the same mammogram and score her risk level so she can monitor her health progress over time.
At the end of the day, our doctors want AI technology and our patients deserve the advantages it brings to everyone.
Artificial intelligence is powering so much in my life today. When it comes to my healthcare, I want that extra layer of confidence knowing that AI is supporting my doctors.
Curemetrics AI-based technology gives doctors more control than ever, resulting in faster and more accurate readings. Because their peace of mind
is my peace of mind.
Accurmetrics
Okay, so what you've seen just now is just one example of a FDA cleared AI-based mammography system. All right, there are actually
Accurmetrics
a
are
few.
advanced algorithms.
So there are a few more. All right, like for example, Profound AI, SageDX, Transpera, and RedNet. All right, so these are actually already available in the market, all right, for radiologists to use. Now, what is the technology behind AI mammography, right? I think sometimes radiologists may be a bit skeptical as to use the AI because they're not sure what is actually behind it, why it works or why it does not work. All right, so first of all, let me just share some very high level idea on how or why AI works and how we actually first started. So we talk about AI, actually it stands for artificial intelligence, and specifically the AI technology that is very popular now is actually artificial neural network. So what's the relationship between AI and artificial neural network? So we talk about AI is actually a very big umbrella, and inside AI, machine learning ML is just one type of AI. And neural network, which is artificial neural network, is a subset or is a kind of machine learning techniques. And more recently, the technology that has actually enabled the tremendous improvement, all right, in medical imaging is actually DL, that's deep learning, which is actually a type of deep neural network. And together with it, we have the convolutional neural network, which is a type of artificial neural network. Now, don't worry about the terms, but basically what we are trying to say here is that the specific technology that has made AI very popular and bring great improvement is actually the artificial neural network technology. So what is actually artificial neural network? So artificial neural network is basically an information processing paradigm that is inspired by the way of the biological nervous system or how the brain process the information. So it is basically a bio-inspired type of network. So what is it actually inspired by? So you could see how human learns, or how we as a child actually learn that this is an apple, this is a pineapple, and so on. So basically our brain processes it. All right, so we are trained such that our parents will give us all the fresh cut, A for apple, O for orange, and so on, and over time we learn. And what artificial neural network is trying to do is it's trying to mimic how the human brain works, so that it can be trained like how we have been trained as a child to learn, all right, to recognize the objects. So this is one example. So a bit more detail, basically we know that in the human brain, all right, it consists of 10 to the power of 30 or more neurons. All right, neurons are actually processing elements in our brain, and we have 10 to the power of 20 or 30 kind of neurons in our brains. And of these neurons, we have the somata or soma, short form, that is actually the body of the cell. And we also have dendrites that actually pass the information along. So what the artificial neural network is that it's trying to model, all right, a lot of these neurons to form a processing information system that can be trained to learn like how a human brain is learned. All right, it's trained to learn new knowledge. So for example, so we give the artificial intelligence system or algorithm a set of cat and dog images and try to train it to learn, all right, to recognize it automatically. So basically, we will give it a large set of photos that are labeled as dog or cats, and these images will be passed through the artificial neural network. In this case, more specifically, convolutional neural network. Just like it has like a human brain where it consists of a lot of neurons. So when these images are passed through, it will learn, all right, the important features that makes a cat, or the important features that will form a dog. So that once this network or system is trained, the next time we pass in a new or unseen cat or dog image, it can actually recognize and tell us whether it's a cat or a dog. And to a further extent, in addition to just classification or classifying an object, whether it's a cat, a dog, and so on, we can actually, the AI or the convolutional neural network actually can perform very advanced tasks now. All right, it can actually perform object detection and segmentation, which means, like, for example, it can detect this is a human, all right, this is an elephant, this is a cat, and so on. And not only that, it can differentiate, like, for example, there are 3 humans here, all right, and there are more than 6 humans here. And not only that, it can actually segment out quite accurately. So you can see, all right, in addition to be able to tell this is a human, it can actually cut out the human quite accurately. All right, so this is a more advanced application of AI where it can detect object and segment out the object accordingly. And how does this work? Like how our human brain works. So normally when our human brain is trained to recognize something, we first look at some features that form, for example, the object. All right, that is analogous to the AI network, neural network, is actually the low-level features like ages, colors, all right, orientation, and so on. So we first learn the low-level features, and then these low-level features together will form mid-level features. So it learns the object parts, like, for example, the eyes, all right, the nose, the ears, and so on. And finally, at the later layers in the neural network, all right, it will learn high-level features. So this is an example of a face recognition neural network. So earlier on, it will learn all these low-level features, then it will learn the object parts, and then it can learn to recognize the human face. All right, for example, it can recognize this human is Dr. Anil, or this human is Dr. Rijo, and so on. Right? So that's how the neural network or the AI deep network actually learns. All right, it actually mimics how our human brain put together some low-level features to form object-level features. Now, what is the significance and impact of deep learning? Now, if we look at the timeline, all right, this is actually what we call the Computer Vision World Cup. All right, Computer Vision World Cup. Why do we call it World Cup? So in 2010, a group of researchers from Stanford actually create a very large data set, all right, that contains millions of images and 1,000 classes of objects. And it tried to train an AI network to recognize 1,000 class of objects. Cats and dogs are just 2 of the classes. It can recognize a vehicle, a house, and so on. It can recognize 1,000 classes of objects from millions of images. And in the earlier, when it was first introduced in 2010 and 2011, you could see we have 2 colors here. One is a traditional computer vision techniques, and second is the deep learning that we talked about just now, the artificial neural network and convolutional neural network. So in the earlier years, when the challenge or the computer vision competition was held, the methods that were used were many traditional computer vision networks. And you could see the accuracy is, the error rate here is about 20% error rate. But in 2010, you notice that there's an outlier here. This is the start of the revolution of deep learning. And this red dot here is actually the first deep learning network. And you could see, compared to traditional approach, it actually increased the accuracy or reduced the error rate significantly to less than 20%. And in 2013, you could see the trend change significantly. In 2012, among all the participation network, only one is actually deep learning. But in 2013, majority of the those who participate in the challenge actually use deep learning network. And you could see the accuracy has actually increased further. Error rate is reduced to less than 10%. And in 2004, the accuracy again improved further and error rate is reduced to about 4 to 5%. And now the accuracy of image classification is actually about 97, 98% of accuracy in recognizing 1,000 images. And how about object detection? Object detection, the improvement is even more significant. All right, if you could see in the earlier years before deep learning started in 2012, you could see the mean average precision or the accuracy is very low, about 40%. But with the introduction of deep convolutional neural network, you could see the accuracy increased significantly. In 2015 itself, it's already increased up to about 80%, right, in object detection. Now, how this affect AI in mammography? So we could see that in the general images, the accuracy of detecting an object and recognizing an object has shown significant improvement. Will this trend also be introduced to medical imaging? Now, let's look at that. So what can AI mammography do? So let's look at some of the existing work. So one of the research, all right, that the computer scientists are working closely with the medical expert is actually in cancer diagnosis. So this is an example of diagnosis of cancer from a mammogram image. So given a mammogram image, all right, a large set of mammogram image, we can train a neural network that can eventually recognize the image as cancer or normal. So which means given an image, it can then train the model to differentiate a mammogram that can recognize whether there's any cancer cell. Okay, this is just an example. Now, what else can it do? So given a high resolution image, what it basically does, in addition to classifying whether it has cancer or no cancer, just like earlier on, we can classify a cat or differentiate a cat image from a dog image. All right, it can now differentiate between cancer and normal image. And in analogous to the object detection, just now given the an image, it can recognize, all right, in the image, there are like 3 humans, 1 elephant. So similarly, in cancer detection or mammography, AI or deep neural network can also be trained to recognize where are the lesions, all right, or where are the cancer cells. So in this case, this is an example of how it does. So given a high resolution full mammogram, all right, it will first identify the candidates, all right, mass localization at different scales. And after that, it will go through another multi-scale process to further shortlist which are the actual cancerous region. And once they have done that, it can even go one step further. So what you see here, this patch of image is now zoomed in into this patch of image. It can now further segment it That means give a more accurate identification of the region. So it goes through another network, and now it can identify this exact region, all right, is where the lesion is. Okay, so this is a reconstructed image with the prediction. So which means similarly to normal image, now AI can capacitate, all right, the cancer detection and localization in AI mammography as well. In addition, there are also some work that actually look into risk prediction. All right, I believe just now Dr. Kesavada has mentioned that early detection is very important. All right, and that is one of the area of research the researchers are currently looking into. This one is actually published in the very reputable journal Radiology. So these are the 4 classes, all right, of the different type of breast from the mammogram, all right, whether it's a fatty, scatter, heterogeneous, dense, and extremely dense. Now from here, all right, one of the dimension is actually radiologist recognition, and one is the dimension of the breast classified by AI. Okay, maybe you can give a guess. All right, like for example, if we look at this, is this done by radiologist or AI? And similarly, if we look at this dimension, all right, so which is actually done by AI and which is done by radiologists? Okay, so interestingly, all right, in this particular research, this is actually done by radiologists. And this is actually classified by AI. From here, what they can conclude is that there seems to be a higher consistency, all right, in the AI prediction as compared to radiologists. Now, this is from this study, all right, from this particular study. But I'm not saying that radiologist is not doing a good work, but all right, later we will see that actually radiologists still do a better work than AI. All right, but from these studies, what they conclude is that AI may have better consistency. All right, in fact, the conclusion here is that there's a wide variation in human interpretation. All right, from this paper, they actually find that 40% of US certified breast imaging radiologists perform outside recommended ranges, all right, for acceptable false positive rates. So this is a further studies, all right. So in fact, the interesting finding here is that they find that in fact AI can actually predict in 97% agreement with an expert radiologist, and they have actually tested this on more than 40,000 all right mammograms, all right, to come into this conclusion for risk prediction. So in risk prediction particularly, you can see that AI is actually doing quite well, all right, in terms of recognizing the different type of density of the mammogram that may eventually give some indication, all right, or help with early diagnosis of cancer. Okay, next question is that we have seen what AI can do in mammography. It can be used to classify, all right, whether a mammogram is cancerous or not cancerous. It can also be used to help to localize and detect where the lesion is, and it can, all right, lastly, be used for risk prediction to help with early diagnosis. The next question is, I'm sure the radiologists will be very interested to know, how well can AI mammography works? Let's look at some of the very recent study. This itself is actually published in the Lancet in 2021 on the readiness for mammography and artificial intelligence. All right, so from this study, they actually look at a lot of AI systems, And they find that 34 out of 36 AI systems evaluated were actually less accurate than a single radiologist, and all were less accurate than the consensus of 2 or more radiologists. Right? So for practical purpose, this is a very insightful findings. So this actually shows that at this point in time, we still can't fully trust AI system, all right? Because the radiology still give better result. But in that case, does that mean that AI is not useful? No, it does not mean that. So what another group of researchers does, also this is published in the Lancet Digital Health, all right, by the group of researchers, and they find that actually combining the strengths of radiologists and AI for breast cancer screening is actually a better approach. So traditionally, this is the existing pathway. So we get 2 readings, all right, from 2 different radiologists, and then we come to consensus conference. All right. So I think at this point in time, there's also agreement that the radiologist readings can also differ. So the practice is that to have 2 readers. So the next pathway is that they compare it with what we call a standalone AI pathway. So they replace one of the reader, which is a radiologist, with an AI. All right, and they set certain threshold to set whether it's all right. The result is cancerous or not cancerous, and then combine with read one is actually a radiologist reading, and combine it to get the consensus conference. Now, interestingly, if you notice here, they achieve a sensitivity of 84.2% and a specificity of 89.5% on internal test data, and 84.6 and 91.3 respectively for sensitivity and specificity on external test data. And this is shown to be less accurate than the average unaided radiologist. Okay, so this does not seem to be a very useful pathway. And then they went on to introduce what we call the decision referral approach. So what they did is that they introduced a new workflow. So for each mammogram, all right, they will first go through the AI prediction first. Normally when we have a prediction by the AI, it also have a confidence level. So it will tell how confident is this prediction. All right, so AI evaluates, all right, with a confidence score. So if AI is very confident that the mammogram is triage has normal, then this will be considered normal. Or if it's very confident that it's a cancer, or it's not confident, or it doesn't have a very good prediction, that means the confidence score for the prediction is not very high, then what they do is that they will pass this set into a decision referral step. Now, this is where they will actually get a radiologist. All right, it will refer to radiologist, which will then perform their diagnosis accordingly, where if BIRA score is less than 3, all right, then they will have either normal, or those that are not very sure, they will put into the safety net and get the second radiologist to look at it. But if they're very sure, then, all right, let's say BRAS is more equals 3, then it will go into the consensus conference. So, but if it's not very sure, then they will actually get another radiologist in the process, all right, and then to come to the conclusion. So in this case, interestingly, it shows that by using this decision referral approach, it can actually improve upon radiology sensitivity by 2.6%. So in this case, the accuracy actually improved. All right. And not only that, it can actually reduce a lot of the workload of the radiologist All right, because if the initial stage for, we know that the large percentage of mammogram actually are triaged as normal. So by being able to confidently recognize the normal mammogram, it actually reduces the workload of the radiologist significantly. And on top of that, by using this approach, it actually improve, all right, or surpass radiologist performance. So you can see that in the conclusion here, it can say, all right, it's actually stated that the radiologist, all right, and AI each has its strength. And if we can actually utilize, all right, the strength and combine the strength of that, both the radiologist and the AI has an assistive tool, it can actually help to improve the performance, all right, and reduce, all right, the workload significantly. So this is actually the conclusion from the paper. Doctors and AI working together was 2.16% better at detecting breast cancer than a doctor working alone, and it raised fewer false alarm. Okay, so this is an interesting finding, and I think the radiologists will be very happy to learn this. We often say that AI will not replace radiologists, and this study doesn't change that. But in the proposed AI-driven process, nearly 3/4 of the screening studies didn't need to be reviewed by a radiologist. All right, that means this part actually is actually 3/4 of all the mammograms. So by doing that, it can actually improve accuracy while reducing the workload of the radiologist. And I believe this is one of the moving forward direction, all right, where radiologists can, computer scientists or AI experts can actually work together, all right, to actually improve the diagnosis and prognosis of the mammograms, all right, the cancer detection in mammogram. So in short, all right, radiologists and AI systems use significant differences in breast cancer screenings, reviewing the potential value of using both human and AI methods in making medical diagnosis. All right, so in this case, every patient in the study will continue to have their mammograms interpreted by a radiologist, but AI will flag and prioritize patients that need additional imaging, all right, improving and facilitating the flow of the medical care. So the last aspect is that what are the technical and clinical challenges? All right, we all know that AI is still very new. Yes, it's very promising, and we see there's a great potential where the radiologists can work closely with, all right, the AI experts, all right, to improve diagnosis and prognosis of the cancer in mammogram. But what are the challenges that remains? All right, so the utilization in clinical setting is still in its infancy. All right, and there are a lot of challenges that still needs to overcome. Like for example, generalizability of the data. So even Stanford, all right, they or the Google medical imaging team, they have actually publicly announced that they are aware of this. All right, in fact, one of the famous computer scientists, Andrew Ng, he said that he have in one of the hospital, they actually created the lung pneumonia detection system, and it shows like near to 100% accuracy in the hospital. But if they actually just take it down to the street to another, all right, diagnosis center, the accuracy actually reduced significantly. So which means if we have a system that is just trained with one set of data, it might not work well in another set of data. So the computer scientists are working on this, and they have come up with various approaches, including, all right, ensuring the usage of data from many hospitals are grouped together to train the model and so on. So this is one of the great challenges. And of course, one another concern, all right, especially by radiologists, is that they want something explainable, all right, not a black box, you put in something and then it shows a result, but how can I trust the result? So this is another technical aspect, all right, the AI experts are working on. And of course, in order to be really used in clinical setting, all right, we need good performance. And not only that, there should be some kind of standardized testing and comparison that can be trusted by radiologists. And of course, workflow and integration. So it shouldn't be increasing the work of radiology. So it should be integrated into the workflow and help with, all right, the radiologists work, all right, instead of giving them more work. And of course, reporting will change as well. And what about the clinical consideration? Performance, of course, is one key of them, workflow and integration. So it's both technical and clinical consideration. And how this can be actually the quality assurance or the CQI, all right, can actually be incorporated into the workflow, all right, enhancing quality using the inspection program. And patients' acceptance, right? I think a lot of patients are still not very comfortable to have a machine to just give them the result, all right? They could probably trust the radiologist more, and the patient need to be given more confidence, all right, and guide them to the acceptance. And of course, the legal aspect of it, we are dealing with patients' data. There are a lot of legal aspects that actually need to be considered. So in short, all right, we have actually looked into the what is the AI technology and how it has actually made its way into the mammography for cancer detection, all right, where it can be used to diagnose cancer, used for risk prediction, or even to localize and find the area or region where there's cancerous cell. But also recent studies, we could see that, all right, AI itself is still not perfect. We need the radiologist expert knowledge, all right? It's still very much useful and needed. And the best way now is for radiologists to work with AI, all right, in some kind of trustable workflow that can help to increase the performance and at the same time to reduce the workflow. All right, we have also looked into the various challenges that need to be addressed in order for this, all right, AI in mammography to be able, all right, to help the radiologist and to also the patient to improve, all right, the early diagnosis and also help in the prognosis of the cancer as well. So there's a sharing, all right, on how AI can help in the prediction of cancer in mammography. And with that, I pass back to Dr. Anil and Dr. Rijo.
Thank you, Dr. Wong. Excellent presentation. I must especially appreciate the very balanced stance that you have taken regarding AI and radiology. I've seen a lot of computer scientists who insist that AI will replace radiologists, but the stance that you've taken is quite balanced, and thank you very much for that.
Thank you.
I would like to ask the panel members if they have any questions that they would like to address first before we try and find out if any of the audience are interested.
Dr. Anil, I have a question here. See, one of the challenges as this is a mammogram-based AI application that Dr. Wong has talked about. But in practice, we often use a multimodality approach to characterize the lesion and often define whether it is malignant or benign. So this fusion imaging also has to be an integral part. And what is the role of AI in ultrasound or the fusion imaging, or even the breast CTs, MR, everything is coming up now. So how AI is going to integrate its role in a fusion imaging kind of scenario?
I'll ask Dr. Wong if you would like to respond to that before I say what my thoughts are on it.
Yeah, sure. Yeah, okay. Thanks for your question, Dr. Rija. Yeah, so in fact, today the talk is actually focusing on mammogram, but actually the research now is also looking into combining the detection of multiple type of modality. That means you can actually use ultrasound combined with a model, an AI model can be trained with multiple types of imaging. All right, and I think this is one of the, and not only that, it can be also even the patient's data can also be passed into the AI model as well. That means on top of multiple imaging, the patient's historical data, all right, those can also be actually used to train a more accurate model. So I think you have a very good point there. All right, so the talk today is very much focused on mammography, but in actual case, there are already research ongoing that looks into the multi-modality approach.
Thank you, Dr. Wong. And to just put what I can say about that, so the basic purpose of mammography as a screening modality for population-based screening is very different from what we practice in India compared to the US or the UK or many of the Western countries, where a patient is just called to take a mammogram and called back only if there is an abnormality detected. We don't have population-based screening here in India, and that is why we usually augment. A patient usually comes with some sort of complaint, and we augment that with ultrasound in order to actually give a final diagnosis. So that's maybe one reason why mammography has been taken as an ideal modality for work, because it's limited to two-dimensional images, although now volumetric data has started to come in. It's one thing. The second challenge as far as ultrasound is concerned is that you don't have a standard acquisition process for ultrasound similar to any of the other cross-section modalities. Ultrasound is a very, very, very user variable tool. So you do not have an option to take exactly the same slices across, say, 10 or 100 different patients the same way using ultrasound. And that's one of the challenges that we will have. But once we have 3D tomo and ABUS as automated breast ultrasound as 3D volumetric data, AI will probably have a lot to say about screening using both.
Just one more question. Say, when we look at a signs of a malignant lesion in a mammogram, the speculated margins of microcalcification. So will the AI be looking at a much more finer aspect of this or than what we are looking at? That means even the minutest changes in the margins, how is it being how is it being trained?
The short answer to that is yes, but the technical I think Dr. Wong will probably be able to give you a better picture, and I can add at the end.
Sorry, I didn't really get your question, Dr. Rija. Are you?
So Dr. Rijo was actually asking the features that we look as human beings on mammograms, like speculations or microcalcifications. Does AI look only at those, or is it looking for much more in the image so that it helps to actually characterize between a malignant lesion and a benign lesion, or between cancer or no cancer?
Yeah, actually, the AI is actually probably looking more than that, because what you could see is that it is not very targeted that just look at those features, but what it does is that it looks at a large, all right, normally a system is trained with a very large, 10 of thousands of images. So those images are labeled as, cancerous or not cancerous, or if let's say in terms of segmentation, we have the labels, all right, that actually shows, like, for example, this region is cancerous or this region is not cancerous. So the model will actually learn a lot of features that is probably more holistic, and including those features that normally radiologists doesn't look at as well. All right, and in fact, recently there are a lot of effort that is actually looking into the explainability. So that means they try to reason out, all right, once the network is trained, it can actually visualize back into what actually caused the prediction of which region or what feature actually caused the prediction of it to be a cancerous region. So it's still a very active research, but we can see there are a lot of more interesting explainability coming up, which I believe in the future it will be very useful for the radiologists to actually help them to be more confident and probably also to gather more insights as to what actually leads to the prediction of the cancerous cell.
See, one of the challenges, it is said that the X-ray mammography sensitivity is only 48%, but one of the challenges is in a dense breast. So are there studies to prove that in dense breast, AI has scored better than radiologists in picking up lesions?
Yeah, I think that is for early detection, right? The risk prediction, right? So in fact, that particular study that did actually show that the AI has better consistency than the radiologist. Maybe because, all right, the nature of the nature of the classification itself, right? So it's actually not so easy for the radiologist to identify. But we can actually train because the AI is actually learning from maybe a larger set of images than the radiologist has looked at. And because there are minute differences, which the radiologist may find it hard to actually differentiate, but because the AI actually looks at much more images, all right, or many more images than the radiologist, so it can actually learn those more fine features.
Anil, Dr. Jaykrishnan from Community Oncology Department of Regional Cancer Center is here. They are one place where RCC is doing a lot of mass screening. Dr. Jaykrishnan, you have got any questions on?
Just a thought. I was just listening to Dr. Wong's presentation, and an excellent presentation. So I would like to know whether AI will replace biopsy as the gold standard because of its accuracy, so that you can, so you have mentioned that you don't need more biopsies which are painful. So whether it will become something similar to biopsy, or can it become the gold standard for breast cancer diagnosis?
Yeah. Okay. So when you talk about biopsy, you're referring to pathology, right? I believe.
Yeah.
Yeah. Actually, in fact, one of my active area research is actually looking into digital pathology. That is a newer area where AI is less work on. But this is actually one of the new area that researchers are starting to move into. So digital pathology actually have a challenge because the data is, the image is very big, right? But this is one of the research area that now the computer scientist is actually moving very much into. It is actually newer compared to mammograms and all those, but we foresee in the near future it can actually give good prediction as well. So like for example, in the digital pathology, some of the researchers in my lab is that we're actually looking at different stains and all those, and from there we try to recognize the cancerous cell and identify where it is and so on. Yeah, so that is one new area that have gained more attention recently. But it's also a more challenging area to look at because of the size of the image.
Yeah, so to answer your question, Dr. Jaykrishnan, it will not replace biopsy, because even in AI, we are only trying to detect malignancy. The confirmation is always going to be histopath. But we have AI in histopathology, but like Dr. Wong said, I am doing a project in pathology as well. One slide image size is like about 4.5 GB, which is maybe 100 times larger than a single radiology, not 100, maybe even 1,000 times more than a radiology image. So we don't have the computing power right now to actually have large scale histopath analysis run. It can be, but not in the immediate future.
Yeah, correct. So, and definitely not replacing the
Yeah,
the pathologist.
pathologist.
Yeah, very soon. I think the radiologist is the AI in radiology is much more established compared to pathology. Pathology is still a long way to go.
And the explainability part is also a big question too. Like Dr. Rijo asked earlier, what exactly is it looking at? So AI is looking much beyond the semantic features of size morphology. It's looking a lot more into actual radiomics, features which we cannot see with the human eye. And that exactly is the problem, because we don't know what it is using to tell us that this is malignant. Which is one of the big questions about black box AI. How does it actually say? And a lot of clarity is still required on what it is actually doing to find out. The results are often stunning, but we don't know how it is saying it. That's one of the problems that we have.
One more thing I would like to know is that Dr. Wong mentioned about risk prediction with AI. So if you are undergoing, if you are taking population-based cancer screening with AI, maybe after a few years from now, so are you going to see a lot of cases? So are we going to see a lot of, a high incidence in breast cancer cases in the future with AI, and which may lead to over treatment? I don't know. See, for example, for aggressive tumors, we need treatment at the earliest. And if we are going to see a lot of cases like that, are we going to see a surge in breast cancer incidence because of population-based cancer screening? Just a comment.
Yeah, I think that's more a question for doctors to answer than Dr. Wong. But if it's okay, like Dr. Jackson said, the problem here is, this was the first question that we asked: why do you want AI and what do you want it to do? There is a large school of thought that says that picking up breast cancers early are not really helping treatment outcomes. So by actually using AI, there is a potential that you might pick up diseases a little early, but whether it will actually help in patient survival is something that has to be answered in the long run. I don't think we are in a position to actually predict the outcomes, but it may help in picking up early. And in a country where there is a large population, it definitely will have some role to play. We are not, like billions of people need screening mammograms situation, or millions. AI will definitely, because you cannot supply enough radiologists to run mammogram screening. Like double-blind reading. How many centers in India do double-blind reading with mammography? It's virtually nil. So the more the number of cases you do, you will need an assistant. And AI is actually the right person for that role. I think that's what we should probably be looking at. Whether it will help is a different question. That's more related to cancer biology than actual detection using computers.
But that point is very well articulated, Anil. Actually, AI can assist and improve the productivity of a radiologist and reduce the false negatives, and that can make a significant difference in the practice. And again, the developments in AI should alert the radiologist to be a clinical radiologist and start communicating with the patients in a better way.
Yeah, that's one of the biggest changes that the RSNA also is advocating, is that there has to be a cultural change in radiology where we come to the clinical discussion room rather than just look and analyze images. So for us to get that free time, we need assistance, and that assistance is probably going to be with AI.
So it's high time for radiologists to have a clinical radiology OPD and to lead the multidisciplinary tumor boards, multidisciplinary disease boards, etc. With the help of with the assistance that is coming from AI, radiologists are in a good position to solve the problems and to take leadership.
Yeah,
but for that, the radiologist mindset or the type of practice that radiologists are currently involved as the image interpreters and readers and report generators, that culture has to change.
Yeah, no, we have to accept AI first. That's the first thing, because only if we accept it now can we actually mold it to what we want. Otherwise, we have a situation where we have engineers developing something and forcing it on us. Whereas if we are part of the process, it might probably translate into much more, better outcomes. So that's my personal take on it.
Yeah, I
I think
agree
Dr.
with
Wong
that.
will also agree. Yeah.
Yeah, especially I think in a very dense populated country like India, it might be very helpful. Like for example, the research work by the published in the Lancet just now, the decision referral approach. I think that will actually help the radiologist to reduce the workload
Yeah.
of the radiologist a lot. So I think AI is a good assistive tool at this moment for the radiologists, all right, to help them reduce their workload. And we hope that by reducing their workload, that will actually be more appealing for them to kind of make use of this.
You get more involved in more relevant
the
parts
culture,
of it.
the culture change.
I think one more aspect we have to consider is the population-based data. That the generalization of data, if it is coming only from the West and that applied to the Indian context or even in the Asian context, that may have a lot of issues related into the practice. So the data also has to come from the local population to have the
correct.
kind of that also is a point that has to be. Otherwise, most of the time we are always looking at the Western data and trying to fit it into our population, and we will find it extremely there can be a lot of false negatives and false positives due to that.
Very, very good point from Dr. Rijo. The data is what makes it accurate. So it definitely needs the local data and not from one hospital, but from multiple hospitals, so that you have a diversity, because there are differences in terms of the imaging equipment, in terms of settings and so on. That's why there's now one approach that they look into is actually federated learning. So federated learning is an approach where the AI actually learns from data obtained from many hospitals, and with the preservation of the privacy. So that is what one of the area of research, because we know privacy is the main concern in sharing of data. That's why this approach called federated learning is actually a way that can preserve the privacy, but at the same time allows many hospitals to share the data and train a model that can generalize well. I believe Dr. Anil is aware of this approach as well.
Yeah, and also about the phenomenon of catastrophic memory loss that happens when you don't retrain it with the initial data as well. Yeah, anyway, that's
so
true.
yes, Anil, as you are a radiologist as well as an entrepreneur, so what are your takes on AI and your application? What are your projects that you are currently leading? And
the projects that I'm dealing with, I'm actually working on 2 radiology and 2 pathology deep learning models right now. Related to the radiology models, one is related to CT and the other one is related to X-rays. And in pathology, I'm doing it on 2 oncology-based subjects. I can't discuss the details because of other reasons, but this is what we're doing now. My take on AI is very simple. I had gone to this meeting about a couple of years back in Barcelona, where there was this neuroradiologist, Dr. Paul Parizel, who is from Australia, and he gave this very nice comparison as to a car having GPS. When we used to drive earlier, we used to stop the car, take a map, or ask somebody the directions to go somewhere. And then when GPS came in, it sort of became the de facto choice for us, because it was doing something which used to be time consuming or error prone for us. So you can liken AI a lot to a tool like GPS for radiologists. And in certain settings, it is a godsend for radiologists, because in situations where we need to spend a lot of time trying to find out things which are very, very labor intensive, AI does things very fast in a lot of situations. And the very fact that AI is very good at narrow tasks, that when you ask it to do something very, very specific, it does generally well. So the biggest thing is that we don't expect AI to do everything, just like feed it data and it'll give you a report is not what we want with AI, but it should help us to do what things that we cannot do or things which we find tough to do. And that is why I say that doctors must get involved in the development process, because we can give problem statements. I would like this to be, for example, sir, you're into fetal imaging. So imagine if you had an AI solution which could quantify Liker, okay, which could quantify Liker in utero. It is much more accurate than having somebody measure the vertical pockets of Liker, which are very, very subjective, right? You might take a different AFI, I might take a different AFI. But what if you had an AI that could actually quantify the Liker and give it to you? And you have an absolute value which you can do. And it does it in the background while you are scanning. Okay, now that's a problem statement which, if a tool using AI can, can be developed, it will help a lot, and it will take a lot of the subjectivity out of fetal imaging, one facet. But remember that it's a very narrow task that we're asking. It's just finding Liker. But the impact of that, when you have an accurate, this thing is going to be much, much greater. Similarly, there are a lot of small things which we can actually get AI to do, and which will make things a lot easier for us. And I believe that radiologists should step forward, and these problems should be brought to people like Dr. Wong, and of course give them the data also, which is what they would be looking for. But they can definitely give us solutions for things like this. And that's where I think that radiologists must take the step forward for AI.
Yes. I think we will wind up the session, Dr. Anil.
Yeah, fine. We can.
Right. So thank you, Dr. Wong, for that wonderful lecture. You've given some insights into the role of artificial intelligence, especially in breast cancer evaluation. And Dr. Anil Prahladan, the moderator, and he is also an entrepreneur from Aramis LLP, and was previously with the Regional Cancer Center. Dr. Jayakrishnan, the additional professor for community oncology, was also joined in. Let me thank all of you, and also wish to thank Dr. Keshavadas, Chandrasekharan Keshavadas, the editor-in-chief of the Indian Journal of Radiology and Imaging, and also the deputy director of Sri Chitra Tirunal Institute of Medical Sciences and Technology, Trivandrum, who inaugurated this session. So the message is clear. The radiologist has to become clinical radiologist, has to step in and has to use artificial intelligence as their physician assistant, and increase the productivity, and also give data from the population, and also has to be shared with the engineers, and also give the problem statements with the engineers, because they are the people who are capable of bringing in the universal principle of leverage, like doing more with less. So they can really accelerate the technology, accelerate the use of technology in medicine, and doctors, medical doctors has to give them their problem statements, and they may be able to solve these issues rather than thinking in terms of a replacement of radiologists. We have to you understand this in the much more holistic perspective, that AI is going to be a useful assistant that can significantly increase the productivity of the professionals, and also will help for mass screening and to cover and to service larger number of patients or larger population. So once again, thank each one of you for who have joined the webinar series today, all the delegates. And we have another session, that's the 9th in this series in this month, on this Kerala Cancer Crusade, the IRIA Preventive Radiology National Program, in association with IRIA Kerala, Susti Foundation, and the Community Oncology Department of Regional Cancer Center, Trivandrum. The 9th webinar will be on 27th, Thursday, and we have a faculty from United States joining in, Dr. Lobamudra Das. She will be talking to us on breast cancer challenges, sustainable solutions, saving lives. Dr. Lobamudra Das is the president of the Breast Cancer Hub, and cancer scientist, research professor, and social entrepreneur who has done phenomenal work in this field. And we will be she will be sharing her experiences. And Dr. Amal Anthony, the president-elect of IRIA Kerala, will be giving us the presidential address. So please don't forget to join us back again on 27th. It is time to say goodbye. And once again, thank you, Dr. Wong, to be with us. I know the difference in time zone. It's almost at 11:30 or 12 there. Thank you for
Thank you,
being
Dr.
with us.
Richa.
Yeah,
Yeah,
thank you
thanks,
for
Dr.
being with
Anil.
us. And
Yeah,
Yeah, it's
thank you,
my
Dr.
pleasure.
Wong, for,
yeah,
yeah.
thank you, Anil.
you.
Thank you, Dr. Jayakrishan. Thank you, Soumya. Good night. Good night.
Good
And,
night.
Thank you, everyone.
yeah,
Good night.
please do join us back again on 27th October for the session on breast cancer challenges, sustainable solutions. Thank you very much.
Great. Thank you.
Thank
Thank
you.
you. Good night,
Yeah,
everyone.
good night. Good night.